I'm Chris Peterson, and we're going to be seeing an interview with a simulated patient who is bringing to the doctor a concern about contraception. There are 3 teaching points associated with this interview. The first is that if a patient brings up a medical issue related to sexual activity, you can assume that you have their permission to make further inquiry. Clearly, if the patient becomes uncomfortable, you may want to confirm that the patient is interested in talking with you about those matters. The second teaching point is that because of the sexual nature of the topic, rather than opening with open-ended questions the way we do in so many other areas of medicine, sometimes it makes sense to start with more focused and pointed questions. That helps the patient know that you're interested and knowledgeable and that you're not going to be judgmental about anything that he or she is bringing to you. And the third point is that sexual issues always have emotional and relational aspects, and that it's appropriate to ask about those during the course of the interview. Well, it's nice to meet you, Kathy. Is it okay if I call you Kathy?
Sure.
Okay. And I understand that you're here because you'd like to switch your method of birth control. That's what the nurse's note said.
Mm-hmm.
Okay. Can you tell me a little bit about what you're on?
I'm on the pill right now.
Okay.
I've been on the pill off and on for 10 years.
Okay.
But in about 6 months, I'd like to start trying to get pregnant. So I think it's probably a good idea for me to get off the pill now and, get ready for that.
All right. And it sounds like you would like to be using some contraception between now and when you actually start trying to get pregnant.
Yes.
Okay.
I'm going to get married in 3 months, so I want to wait until then.
Okay.
Before we actually conceive.
Okay. That makes
so I
sense
definitely
to me.
need some alternate method until then.
All right. You're on the pill now. Have you had any problems being on the pill?
Pill's been good.
Okay, good.
Yeah.
Have you ever used any other methods of birth control?
In my past relationships, we used condoms also.
Mm-hmm.
I've had 3 others, and 2 of those we used, no, all 3 of them, condoms and the pill. And then when I got together with my fiance, we've been together for 4 years, so after the first year, he didn't like using condoms, so we got tested for STDs, and we both came out clean, so we gave up on those.
Great. So it sounds like you don't have any concerns about sexually transmitted infections at this point.
No.
And we don't need to do any special testing.
Right.
Okay. Have you had any STDs in the past?
No, I had a yeast infection once, but
Okay.
I don't think that's an STD.
No? Right. Good. Okay. You mentioned a couple of past sexual partners. Were they all males?
Oh, yeah.
Okay. And I ask that just because it's important to know whether
sure.
there's more than one partner or there are any issues that you would like to bring
Right.
up while we're talking here. I also am interested in knowing, in terms of planning the pregnancy, you said the wedding's going to be in about 3 months and the pregnancy a little bit after that, and you'd like a real reliable method of birth control between now and when you actually start. You've used condoms in the past, but not any of the other methods like a diaphragm or an IUD. Is that correct? Okay.
No, I don't really know anything about those,
Okay.
actually.
All right. So we'll talk about them in
Okay.
quite some detail. I'm also interested in knowing, currently with your fiance, are you having any pain with intercourse or any sexual difficulties?
No, everything just seems to get better.
I'm glad to hear that. That's really nice to know. Have you in the past had any problems with intercourse?
I actually had an abortion when I was 18, right after I first started having sex, because I didn't use anything, so that sort of happens. And it seemed like after I had sex, after the abortion, I felt pain, but I thought it was psychological. But when I went to my annual, they said, well, you've got a yeast infection. So I was treated for that, and then they changed my pill to a more estrogen-heavy one. And I haven't had any problems since then.
Oh, that's good to hear. That's good to hear. You mentioned the abortion. Were there any either physical or emotional problems around the time of the abortion?
I mean, I was sad, you know, but there were no physical complications.
Okay. And how are you doing now with respect to the abortion? Is that something that you're...
I really look forward to getting pregnant, you know. I mean, then it really scared me, you know.
Okay. Is your fiance aware of the fact that you've been pregnant before?
We've actually talked about it quite a bit.
Okay. All right. So it's nice to know that the system is working right and that you can expect another planned pregnancy
Yeah.
quite soon, I hope. Right. All right. So let's do an exam first, and that will help me help you choose from among several different methods that might be available.
Okay.
And then we can also perhaps talk about how to decide, or to figure out when you're ovulating and how best to time intercourse.
Yeah, I want to know those things.
All right, and we can also talk about some other health issues that you might want to be thinking about as you are trying to get pregnant, specific nutritional ones and
Right.
exposures to toxic
Right. Do I
substances. Make
need
sure your
supplements or?
immunizations are up to date, all that
Okay.
kind of thing. Great. I'll look forward to sitting down and doing that, but let's do our exam first.
Okay.
Okay.
Thanks, Dr. Peterson.
You're welcome. We just saw a video of a patient coming to her doctor with a request for help in changing her method of contraception. The teaching points associated with this video are, number one, when a patient brings to you a medical issue related to sexual activity, you can assume that she's giving you permission to inquire in more depth about her sexual practices. Number two, remember that because of the sensitive nature of the topics, you may want to start initially with some directed and focused questions and then move on to open-ended questions. And number three, remember that sexual issues always have emotional and relational aspects, and that it's fine. As a matter of fact, it's often very appropriate to ask about those aspects as well as the more medical aspects.